Hello guys, so today is the 15th of December 2018, and a headline on CNN.com says a judge in Texas has just struck down the entire Affordable Care Act in the US. Now I'm not quite sure what to make of it. I thought this was legally settled years ago, but I'm not a lawyer and I'm not really interested in the legalese. Maybe that'll get worked out, but all I can say is that I'm deeply saddened that in the US there are still forces fighting against health coverage for average, everyday people. I recently deleted some of my videos so I could remake them into concise points. And as a dual national who was born in the US but now lives permanently in Canada, I just wanted to make a few quick points of comparison. Number one, in my judgment, healthcare in Canada is absolutely better. It isn't perfect here because we have open and free access for all. There are some waits for elective, non-life-threatening care, and it's probably higher than some of the US for some categories. But the waits are reasonable. For example, last year I told my family doctor in December I had some bowel discomfort. By mid-January, I was speaking to a gastroenterologist at a specialist clinic, and I had my colonoscopy a few weeks later by February. The specialist spent an hour with me going over symptoms before the test. I was treated exceptionally well. I also told my family doctor I was having allergy symptoms. Separate from that, and 4 months later, I was at an allergy clinic, had an appointment with the allergy doctor himself, performing the droplet test on my arm to see what I was allergic to. The care I received was great. The only thing OHIP didn't cover for all of those specialist procedures was $65 for a blood test, basically to see if I had more severe dust mite allergies. Otherwise, I paid nothing. I also know of a friend whose father walked into his family doctor, complained of symptoms, and he was having open heart surgery here in Canada less than 24 hours after that. Her father is alive because the Canadian system was there for them, and the care was incredibly good, and quick, might I add. So, you know how much they paid? Virtually nothing. They might have paid something like $20 for a semi-private room service, like watching TV after the surgery was over with. Sure, you might be able to buy a faster allergy test in the US for an elective procedure like that versus the 4-month wait I had to go through. But I still received great care at the end of the day. And the services were triaged. I'm not going to die if I don't have an allergy test in 2 weeks. The fact is, in America, you can go without health care because of cost altogether. That's why some specialists in the US can be accessed more quickly, because you have like 100 million citizens at any point in time with no insurance, or they're underinsured and can't afford it. That makes wait times lower for the other people. That does not happen here in Canada. We have free choice of doctor with open and free fair access for all. Most items are covered at 100% without so much as a monthly premium, deductible, copay, or coinsurance for most provinces. Number two, the next point, I'm going to try to make the rest of these quick. Don't believe the lies from the pro-business and pro-privatization forces that want to keep healthcare just a pure for-profit industry in the US. Canada actually has a hybrid system of healthcare. There's quite a bit of profit here too, you know. But the insurance is public, and for the things it doesn't cover, you still have to buy a private supplemental plan or pay out of pocket like I did. Number three, Americans need to stop being paranoid about the role of government. No, this doesn't apply to all Americans, obviously, but there are still too many people in the US that get completely bent out of shape when the role of government comes up, and basically there is a role for government when it comes to healthcare, and it should be used to benefit everyday people, not the big corporate interest in the pharma, insurance, and hospital industries. Number four, when it comes to serious health ailments, Canadians are actually living longer than Americans. For example, a scientific study suggests Canadians with cystic fibrosis on average live 10 years longer in Canada than the US. That's because the health system here in Canada has continuity. People can be guaranteed to continue treatment with the same specialist team regardless of your employment, financial status, or any other factor. You can read, I've put a link from the CBC News below on this topic. So, to summarize, I don't know what's happening in the US. I want the best for you guys. You're my friends, you're my family, I care for you. No healthcare isn't perfect here in Canada either, but it works incredibly well, much better than the US. And I don't see myself ever moving back to the US, in part because of how terrible dealing with private insurance networks are. The high premiums, the deductibles, the co-pays, and if Trump and his cabal allow insurance companies to legalize exclusions and denials of care again, all I can say is hell no. I don't want to deal with that mess ever again. It saddens me to say this, but it's how I feel. Thank you for watching.